Hey friend, welcome back to Health Mode. Let me ask you something real quick. When you check your blood pressure and you see those two numbers, do you actually know which one matters most, especially after 60? Because right now, as you're watching this, there may be a silent war happening inside your arteries. And the scary part is, millions of people have been tracking the wrong number their entire lives. For decades, most doctors told us to focus on the bottom number, the diastolic pressure, the one that sits quietly under the line. People were taught to fear that lower number, to chase it, to obsess over it. But modern research has flipped that story upside down. A massive study that followed over 1 million adults found something that should stop you in your tracks. One of those numbers predicts your risk of heart attack and stroke with shocking accuracy. And the other one barely mattered at all in people over 60. That is not a small detail. That can literally be the difference between living normally and facing a sudden, life-changing emergency. And what makes this even more disturbing is that this information wasn't shouted from the rooftops. It sat buried in journals and studies while millions of seniors kept staring at the wrong number, feeling safe when they were actually at risk. Because here's the truth. The dangerous number doesn't just rise with age, it behaves differently in older adults than it does in younger people. Your arteries change after 60 in a way that rewrites the rulebook. A reading that meant nothing at 40 can be a screaming warning sign at 70. Yet most people were never told that crucial distinction. They check their blood pressure at home, see two numbers, and no one ever clearly explains which one deserves their attention. And that confusion isn't just inconvenient, it's dangerous. Because if you focus on the wrong number, you can feel calm when you shouldn't. You can delay action, you can skip lifestyle changes, you can ignore patterns that need attention. But stay with me, because what researchers discovered next is the real jaw-dropper. In 2019, a landmark study published in one of the world's most respected medical journals analyzed 36 million blood pressure readings. 36 million. And what they found about the top number completely rewrote the textbooks. The results were so clear that major health organizations had to update guidelines. And this single finding explains why so many older adults with acceptable blood pressure readings were still having heart attacks, strokes, and other serious cardiovascular events. The answer was hiding in plain sight. And by the end of this video, you'll understand exactly why it matters for you and what you can start doing today. Quickly before we dive in, drop a comment and tell us your age and where you're watching from. We actually read the comments, and your story can help someone else. All right, let's get into it. Item 5. The diastolic deception in aging arteries. Let's start with something that surprises almost everyone. That bottom number, the diastolic pressure, often becomes less important as you get older. I know that sounds backwards because it goes against what most people have heard for years. Diastolic pressure measures the force inside your arteries when your heart is resting between beats, the quiet moment, the pause. In younger adults, that number can be very meaningful. But something fascinating happens with age, and once you understand it, you'll never look at blood pressure the same way again. Research published in the Journal of the American College of Cardiology followed over 8,000 adults for more than 2 decades. The findings were remarkable. In people under 50, elevated diastolic pressure strongly predicted future heart problems. But in people over 60, that connection basically disappeared. The researchers found that in older adults, diastolic pressure had almost no independent relationship with heart attack or stroke risk once the systolic number was taken into account. Think about that. The number many seniors obsess over often matters far less than the number sitting above it. So why does that happen? It comes down to what happens to your arteries over time. When you're young, your arteries are flexible and elastic. They stretch and recoil with each heartbeat like a rubber band. That elasticity keeps both blood pressure numbers more balanced. But as the decades go by, those arterial walls gradually stiffen. Elastin decreases, collagen becomes more dominant, calcium deposits can build up. The smooth, stretchy tissue becomes rigid and less forgiving. And when that happens, your heart has to work harder to push blood through vessels that don't give like they used to. The result? The top number climbs, while the bottom number often stays the same or even drops. Now here's where it gets especially important for older adults. There's a phenomenon called isolated systolic hypertension, and it affects up to 30% of adults over 65. That means the top number is elevated while the bottom number remains normal, or even low. For years, some doctors dismissed this as normal aging. They focused treatment mainly on cases where both numbers were high, but research tells a very different story. The Framingham Heart Study, one of the longest-running cardiovascular studies in history, showed that isolated systolic hypertension dramatically increases the risk of heart failure, stroke, and kidney disease, regardless of what the diastolic number says. So here's the practical takeaway. If you're over 60 and your bottom number looks fine, but your top number is creeping up, don't assume everything is okay. That pattern deserves attention and a real conversation with your healthcare provider. Can arterial stiffening be completely reversed? Not fully, but it can be slowed, managed, and improved more than most people think. Regular physical activity has been shown to maintain arterial elasticity better than almost any intervention. One study from the University of Texas found that adults who exercised consistently through middle age had arteries that looked like those of people 20 to 30 years younger. So the message is clear: don't ignore the top number just because the bottom number looks reassuring. Now that we understand why diastolic pressure loses predictive power with age, let's move to a factor most people never even consider. Item 4. The pulse pressure gap. There's a third number hidden inside your blood pressure reading that almost nobody calculates. And for older adults, it can be one of the most revealing indicators of cardiovascular health. It's called pulse pressure, and it's simply the difference between your systolic and diastolic numbers. If your blood pressure is 140/80, your pulse pressure is 60. And that gap tells a story about your arterial health that neither number reveals on its own. A large study published in the journal Hypertension examined data from nearly 20,000 older adults over 15 years. Researchers found that for every 10-point increase in pulse pressure, the risk of major cardiovascular events jumped by about 13%, even when systolic and diastolic numbers were sitting in acceptable ranges. Here's a simple comparison. Someone with 130/60 has a pulse pressure of 70. Someone with 130/80 has a pulse pressure of 50. Same top number, totally different risk profiles. And yet, most guidelines barely mention this. Why does pulse pressure matter so much? Because a widening gap is a marker of arterial stiffness. When your arteries can't expand properly to absorb the force of each heartbeat, that energy has nowhere to go. The top number rises while the bottom number stays put or falls. Think of a garden hose. A flexible hose absorbs some of the water pressure. A rigid hose transmits that force directly. Your heart is pushing blood into a system that either cushions the push or amplifies it. Stiff arteries amplify it, and your brain, kidneys, and heart receive that amplified force with every single beat. For seniors, the implications are huge. A pulse pressure above 60 is generally considered elevated. Above 80 raises serious concern. And one major study, the Rotterdam study, following over 5,000 older adults, found that pulse pressure predicted cognitive decline and dementia risk better than either blood pressure number by itself. Why? Because constant pounding from elevated pulse pressure damages the small blood vessels in your brain over time. It accumulates quietly for years, and by the time memory problems are obvious, significant damage may already be done. Managing pulse pressure often means focusing primarily on lowering systolic pressure, because in many older adults, diastolic pressure is already low, and pushing it lower can reduce blood flow to the heart during rest. Certain medications that target arterial stiffness, such as some calcium channel blockers, have shown particular benefit for isolated systolic hypertension with wide pulse pressure. But beyond medication, sodium reduction can make measurable changes surprisingly fast. One study from the University of Delaware found that cutting sodium to under 2,000 milliliters per day reduced arterial stiffness by about 14% in older adults within just 5 weeks. In other words, your arteries can literally become more flexible when they're not constantly exposed to excess sodium. Pulse pressure is powerful. But there's an even more dangerous pattern researchers have found. Item 3. The morning blood pressure surge. Your blood pressure doesn't stay the same all day. It rises and falls with your internal clock. And for older adults, what happens in the first few hours after waking might be the most dangerous time of the entire day. Researchers call it the morning blood pressure surge, and the studies linking it to cardiovascular catastrophe are honestly alarming. This helps explain why heart attacks and strokes most often occur between 6 a.m. and noon. Your body is at its most vulnerable right when your day begins. The Japan Morning Surge Home Blood Pressure Study followed over 4,000 older adults, measuring blood pressure at night and again immediately after waking. People with the largest morning surges, defined as an increase of 55 points or more from nighttime levels, had more than double the risk of stroke compared to those with smaller surges. And here's the scary part. This was true even when average blood pressure levels looked similar. Two people could have the same average numbers, but the one with the bigger morning spike faced far greater danger. So, what causes this surge? Your wake-up systems kick on. Cortisol rises, adrenaline increases, your nervous system shifts from rest to action. Your blood gets slightly thicker after hours without hydration. Platelets become stickier and more prone to clotting. All of this happens at the same time, exactly as you transition from sleep to wakefulness. In young, healthy arteries, that transition is smooth. But in stiff, aging arteries already dealing with elevated systolic pressure, the daily morning surge becomes a repeated assault on vulnerable blood vessels. So what can you do? First, timing matters. If you only check your blood pressure once in the afternoon, you may never see this pattern. Try measuring within 1 hour of waking before medications and compare it to an evening reading taken around the same time each night. If the morning number consistently exceeds the evening number by 40 points or more, that pattern is worth discussing with your doctor. Some studies suggest that taking blood pressure medication at night instead of the morning may better control the morning surge, but that depends on the person and should be guided medically. Your morning routine matters too. One study in the European Heart Journal found that eating breakfast within 2 hours of waking helped moderate the morning surge compared to skipping breakfast. Hydrating immediately on waking helps counter the blood thickening that happens during sleep. And gentle movement before jumping out of bed, like ankle circles and leg stretches, gradually activates circulation without triggering a sudden spike. These are simple changes. They cost nothing. They take minutes, yet most people are never told they could have protective effects. But there's still one more blood pressure behavior that may be even more concerning for seniors. Item 2. Blood pressure variability. Most people only look at whether their blood pressure is high or low, but emerging research suggests something else matters just as much: how much your readings bounce around. This is called blood pressure variability. The fluctuations from day to day, week to week, or visit to visit at the doctor's office. And research on this is changing how we think about blood pressure risk. A major analysis published in Lancet Neurology looked at data from over 77,000 patients. The results were striking. People with high visit-to-visit variability in systolic blood pressure had a 65% higher risk of stroke compared to people with stable readings, even when average blood pressure levels were similar. Let that sink in. Two people can have the same average blood pressure over a year, and completely different stroke risk based only on stability. Why? Because swings create repeated stress on arterial walls. Your vessels experience cycles of stretching and relaxing over and over, which accelerates damage to the inner lining. Plaques can become unstable, tiny ruptures can happen more easily, and the protective adaptations your vessels develop under consistent pressure don't fully form when the stimulus keeps changing. It's like bending a wire back and forth versus holding it in one bent position. Repeated flexing causes fatigue and, eventually, failure. In older adults, several things increase variability. Baroreceptor sensitivity declines with age. Baroreceptors are pressure-sensing cells that help your body adjust. When they become less responsive, regulation becomes less precise. Medication timing also matters. Some medications wear off sooner. Others require multiple doses, and inconsistent timing can make variability worse. Taking pills at random times virtually guarantees more fluctuations. Reducing variability starts with consistency. Take readings at the same times under similar conditions. Take medications consistently at the same time each day. And if you're on medication 2 or 3 times daily and seeing big swings, it may be worth asking your doctor about longer-acting, once-daily options. One Oxford study found that longer-acting medications that maintain stable levels across a full 24 hours significantly reduced cardiovascular events compared to shorter-acting drugs that require multiple doses. Variability matters, but now we come to the single most important factor for seniors. Item 1. Systolic blood pressure. The strongest predictor. After everything researchers have studied, one factor stands above the rest: systolic blood pressure, the top number, the pressure when your heart contracts and pushes blood through your arteries. The evidence is so overwhelming, so consistent, and so definitive that there's really no scientific debate left. For older adults, systolic pressure is the number that matters most, and managing it can genuinely add years to your life. The SPRINT trial, published in the New England Journal of Medicine, assigned over 9,000 adults to two treatment targets. One group aimed for systolic under 140 and the other aimed for under 120. The study was stopped early because results were so dramatic. The lower target group had 25% fewer cardiovascular events and 27% fewer deaths from any cause. That's not a tiny improvement. That is life-changing prevention, and the benefits were especially strong in adults over 75. Why does systolic dominate risk in seniors? Because of arterial stiffening. When arteries lose flexibility, they can't buffer the force of each heartbeat. That force gets transmitted straight to your organs, your brain, your kidneys, and your heart. Over millions of beats, that amplified pressure wave contributes to small vessel disease, cognitive decline, kidney damage, and heart failure. Diastolic pressure during relaxation simply doesn't carry the same mechanical impact in an aging arterial system. The massive 36 million reading analysis from Kaiser Permanente confirmed this with enormous statistical power. In people over 50, systolic pressure overwhelmingly predicted cardiovascular events. For every 20-point increase above normal, the risk of death from heart disease or stroke roughly doubled. Higher systolic meant higher risk, with no safe plateau. That was true at 130, 140, 150, and beyond. The myth that a little high is okay when you're older was officially crushed. So how do you manage systolic pressure? It usually requires a comprehensive approach. Sodium reduction helps. The DASH diet, emphasizing fruits, vegetables, whole grains, and low-fat dairy while limiting sodium, has shown reductions in systolic pressure by about 8 to 14 points in many people. Physical activity helps too. Regular aerobic exercise often lowers systolic by about 5 to 8 points on average. Weight loss can lower systolic by about 1 point per kilogram lost for those who are overweight. Moderating alcohol, managing stress, and sleeping well all add incremental benefits that stack up over time. And medication is essential when lifestyle changes aren't enough. Evidence strongly supports treating isolated systolic hypertension in seniors rather than watching and waiting. Multiple classes work: thiazide diuretics, calcium channel blockers, ACE inhibitors, ARBs, and combinations often work better than maxing out a single drug. The key is reaching a meaningful target, not accepting almost controlled as good enough. Work with your healthcare provider to set a clear systolic goal based on your personal health and then pursue it actively. When you truly understand which blood pressure number matters most, it can be one of the most valuable health insights you gain this year. Because the full picture is not just one number, it's understanding why diastolic loses predictive power with age, watching pulse pressure, paying attention to morning surges, and minimizing variability. Together, these patterns predict your real risk far better than any single reading ever could. And here's the best part. You now have knowledge many people never receive. You know why the top number deserves focus. You know how to check morning readings to catch hidden danger. You understand that stability matters, not just the average. Now, I want to hear from you. Have you noticed your blood pressure is higher in the morning than in the evening? And if you have, what helped you keep it more stable when you first wake up? Drop your experience in the comments. And if you or someone you love deals with high blood pressure, share what symptoms you noticed, because your story can help someone else. Thanks for watching Health Mode. If this helped you, hit like, subscribe, and I'll see you in the next video.